morning. My name is Tina Nordine, and I'm your family nurse practitioner student today. Before we get started, I just want to get consent. This video is going to be shared on YouTube just to my professor. It's going to be listed as unlisted. So I just want to make sure that you do consent to the recording of this video and sharing it to my professor for analysis. This is Dana Morris, and she has consented to recording of this video. Today, Dana, we're going to do a neuro assessment. So I'm going to check a whole head-to-toe assessment of your neurology and physical features, okay? I do have some equipment over there, and if my videographer can show that I have some equipment, we will share with her that equipment, and I will walk you through each and every step. Okay, so Dana, will you tell me your full name?
Dana Davis Morris.
Okay, and what year were you born?
1972.
And where are we right now?
North Augusta, South Carolina.
And this is
my home.
In your home, okay. And Dana, tell me, what does it, well, let me give you 3 words. I'm going to give you 3 words that I want you to remember and to record to remind you later, okay? So the 3 words: football, baseball, and dog.
Okay.
Okay. Dana, tell me, what does it mean to if there was a fire alarm?
If there was a fire alarm?
Mm-hmm. What would that mean to you?
For safety for your home, in case there's a fire that would go off.
Okay, that sounds good. I know that all these questions seem a little crazy, but there is a reason for each and every one of them. Now, Dana, can you tell me your husband's birthday?
August the 8th, 1968.
Okay, and do you remember those 3 words that I told you earlier?
Football, baseball, and dog.
Very good. Can you count backwards by 5 from 100?
So 100, 95, 90, 85, 80, 70.
Perfect. Very
70.
good.
Okay.
Very good. That's always hard to do. How about the word plate? Can you spell that backwards?
ETALP.
Very good. Okay. So that is the beginning part of our neuro assessment, and that just tells me a little bit about how you think and just your analysis on what you do with in your brain. So it looks like everything is normal and intact at this point, okay? So the next step of the neuro assessment is the cranial nerves. So there's 12 cranial nerves, and I'm going to test each one of them, okay? So first, I've got to grab one thing from over here. Actually, it's in my pocket. And Dana, what I'm going to ask you to do is I'm going to ask you to close your eyes, and I'm going to ask you to occlude or cover one side of your nostrils.
Like this?
Yes. And I'm going to ask you, this tests your smell, cranial nerve number 1. Will you tell me if you can smell this? And what smell that is?
Peppermint?
Correct.
Oh.
Very good. And if you'll, now if you'll keep your eyes closed, occlude the other nostril. And I'm going to ask you if you can smell this with that nostril.
Peppermint.
Exactly.
Okay.
Very good. So it is a peppermint flavor, and you can open your eyes now.
Okay.
So that was cranial nerve 1. So just wanted to make sure that that is intact. So cranial nerve 2 is your optic nerve. And so a couple of things with that, I've got to check your sight and your vision, okay? So I've got to grab a couple of tools here. And with that being said, looking at your optic nerve, this is called the Snellen chart. It's a pocket chart. And this chart, usually there's a large chart on the wall, and when you have a large chart on the wall, you would be 20 feet from it. With a pocket chart, you would be 6 feet from, okay? And what I would do is I'm going to ask you to cover one eye, and if you'll help me to read which line you're able to read, okay? So cover one eye, and you are now covering your left eye. And see if you can read this line. And I know, Dana, generally speaking, you sometimes had trouble with seeing, so you do sometimes use glasses, is that correct?
Sometimes.
So just tell me which line you're able to see.
I think the bottom.
Okay.
LTFPH.
Correct. All right, and that means you are 20/20 vision in that eye. You'll occlude the other eye, and then read that same line. And if you'll read that backwards.
All right, I'll tell you what, let's go with that, maybe start with that E.
Okay, there you go.
No, the third.
Okay,
Two,
okay,
yeah.
okay.
EPTZO.
Correct.
And then the next one, GFDHJ.
Correct.
And then you may read the bottom.
Sure, go
backwards.
ahead and do that. Either way.
Yeah. HPFTL.
Perfect. And essentially, now in your vision, you are not seeing 20/20, but I know that you knew that already. But
Right.
for the purposes of this assessment, in this, I would tell the patient whether or not they were 20/20 vision based on what the chart or what line they were able to read. So I would share with them, you know, if they had good vision or if they needed to have, you know, their eyes examined and maybe look at getting some glasses. So, and I know that for the purposes of this particular assessment, your eyesight is not always 20/20.
Exactly.
And that's okay. That's okay. So a couple of other things. I'm going to take a peek at your pupils, and I'm going to also look behind your pupils, looking at your retina, your optic disc. I'm going to look at the blood vessels behind your eye as well. The optic disc and optic cup are a 1:3 ratio, and I'm going to look at both of your eyes. Okay. So what you'll see is a little bit of a light. And I'm going to hold since I'm on your right side, I'll place this ophthalmoscope up to my right eye into your right eye, okay? And so I'm going to just do, and what I'm seeing is a red reflex. So that means that I'm seeing the reflex of your pupillary response, okay? And I'm looking into your eye. And what I can do is I can gently place my hand on your face so that I don't damage you in any way, shape, or form. I'm looking at your eye and around your optic disc and your blood vessels. They look good. And I will be using this light fixture for something else as well. Okay? And so I would do the same thing on this eye. We'll look at your optic disc, the cup, the blood vessels, and your retina, and looking behind your pupil. Okay? So we're doing it again for safety. I can place my hand right on your forehead. And again, left eye to the left side, and place the light into your eye. You do not. I've got a red reflex here, and very good. All right. While I have my light, excuse me, I also want to look at your pupillary response. I'm going to look at direct and consensual. And what that means is your pupils will respond directly to the light as well as the other eye consensually, okay? So if you'll look right over to that picture frame there, and I'm looking directly, shining a light into your eye, and I see a pupillary response here directly, and then while I do the same, I'll shine the light in this eye, and I do see a consensual reflex in the opposite eye. And so I will do the same on this side. I see a direct pupillary response. And then again, on this side, I see a consensual response in the opposite eye. So your optic nerve looks good. That's optic nerve, or cranial nerve number 2. So let me see what I've got. Grab my next. Let's see. Did I do your both? Okay. So I want to look at confrontation, or looking at the peripheral vision. And so what I'm going to do is I'm going to ask you to cover your right eye, and I'm going to cover my left eye. And when I do this, I'm going to ask you to tell me how many fingers I'm holding up, okay? So and you'll just be looking at me right at my nose, okay? Do you see how many fingers I'm holding up?
4.
Okay, and on this side?
3.
Okay, very good. And if you'll cover the other eye, and on this side,
2,
and
3 or 4.
Okay, 3. That's okay. And again, for the purposes of the assessment, essentially what we're doing is we're looking at the peripheral vision on either side. So we can do that by the numbers test or by the wiggle test, and that's testing for confrontation. Okay, let me see. I want to make sure that I get the next. Oh, I forgot. With that, there's a word called nystagmus, and that's looking, when I was looking at your eye with the light, I'm looking for any type of jumping or twitching in your eyes, and motor or movement in your eyes, and I did not see that, so that's negative for you. Okay, so that's negative. So let me grab my next thing that I need to grab, and I do need to look at your ocular motor and cranial nerve 4, 6, and 3. Ocular motor, abducens and the trochlear. And with that, we're looking at the 6 fields of gaze. And what I'm going to ask you to do is just to follow my finger into the 6 fields of gaze. Okay, so we're going to go over and down, over and up, and then back to the middle. And I'm going to come in here, and I see that your eyes are able to cross. And that is actually normal. So your cranial nerves are intact. So that is cranial nerves 3, 4, and 6.
Okay.
All right, and so the next cranial nerve is cranial number 5. And I want to make sure that I get, we're going to get a cotton ball, a tip here. And what I'm going to do is, if you will allow me, I'm going to just place my hands on your jaw here. And if you can move your jaw side to side. And also, if you can turn your head to the left, or your left, and to the right. So I'm looking at facial strength on either side. Now I'll ask you to close your eyes, and I'm going to ask you if you can feel either a sharp or a dull touch, okay?
Mm-hmm.
So how about right here?
Yes.
Mm-hmm.
Was that more soft? I don't know.
No, you're fine. Let me grab a different tool. How about this one?
I mean, it's not hard, but it's not so.
Right. Let me have you open your eyes so you can
Sorry.
see. No, you're perfectly fine. That's part of part of my job is to share with education and make sure that my patient understands the testing that we're doing. So I want to make sure that I provide that education to you. So what I have here is a cotton tip. This will be your soft side, and then this is going to be more of the sharp side. And also, I'm being quite gentle. So,
So
in the clinical setting, in order to test for sharp or dull, I probably don't want to be as gentle as I am with you today.
okay,
Okay.
that's fine.
So I'll ask you to close your eyes again,
Mm-hmm.
and if you can tell me if you feel this.
Soft.
That was soft, and then here.
I guess hard.
Okay, and then one more time.
Hard.
Okay, and then I'm going to do it right here.
Hard.
Okay, very good. While I'm here, while I have my tip, sharpened, and well, we'll go on to the next cranial nerve, and then we'll go on to the extremities. So that was your cranial nerve number 5, and now we will test. We've done cranial nerve number 6. Cranial nerve number 7 is your facial nerve, and with that, I'm going to ask you if you can wrinkle your forehead. Can you wrinkle your forehead? So that's part. I know that it sounds silly. It does sound silly. Can you smile? And can you frown? And can you puff your cheeks out? So cranial nerve number 7 is intact as well. So I know those all sound a little silly, but they were definitely those that we have to test.
Okay.
So let me see. I've got to grab my tools here and see. The next one is the acoustic. So I'm going to change my tool to the one for checking for hearing. I'm doing that real quick. And when we do that, one of the things that I'm doing is listening. Part of my assessment is listening to you as you walk in and as you're speaking to me. And while you're speaking to me, I've noticed that you've not said huh or what, meaning that you are able to hear me. Okay, so part of the exam, if I were doing a complete head to toe exam, I would also look into your ears, check your hearing. I would look into the eardrum and check to see if things are okay either way. So what I'm going to do today is I'm going to do what's called the whisper test. I'm going to ask that you close your eyes, cover one ear, and from the other ear, I'm going to whisper something to you, and I'm going to see if you are able to hear that, okay?
Okay.
Excuse me. So if you'll cover that ear, close your eyes.
Baseball.
Okay, and if you'll cover this ear. Apple. Okay, so you're able to hear me in the whisper test, and then you were, and like I said in the assessment, I would use my scope to look into your ears. The next exam is called the Weber's test and the Rhine. So what I'm going to do is I'm going to take my tuning fork, and with this does not hurt. It looks a little, metal, but it does not hurt at all. And I'm going to place this tuning fork right on your forehead, and you're going to tell me if you can hear it or not, okay? And then once you are not able to hear, if you'll let me know.
Okay.
Okay? Not able to hear that? I don't think I hit it hard enough.
Like, can I hear that?
Mm-hmm. And do you hear it evenly in both ears? Okay. And then I'm going to also do the tuning fork behind your ears and on your mastoid, and then I'm going to take it away from your ear. That's the rhyme test, and see if you can hear it. Okay. And we're looking at air conduction versus bone conduction.
Okay.
Okay. And this goes right behind your ear.
Just if I can hear it.
Mm-hmm.
I hear it.
Do you hear it now?
No.
Okay. And then one more time on the other. We always do everything bilaterally on either side. Are you able to hear that?
Not now.
Okay.
It's stopped.
No problem. So that is the rhyme test, and we want to make sure that we test that to test for air conduction. Now, if I don't have a tongue depressor, but if I did have a tongue depressor, what I was to look at the next cranial nerve, I'm going to look at your gag reflex. So I'm not going to ask you to do the gag reflex today, but I am going to ask you to open your mouth and say ah. You can do that. Ah, very good. And then I would place this here on your tongue to assess if you had a gag reflex. And hopefully you do, which is a normal thing. Okay?
Okay.
And so that would test for cranial nerve number 9, which is the glossopharyngeal. The next would be checking your vagus nerve. And if I had a glass of water, I would ask you to swallow. And then I'm also going to feel behind you as you swallow now, okay? So I'm going to feel your trachea, and if you can swallow. Okay, and you didn't have any difficulty with swallowing, and everything seems to be in place on your trachea. So, and again, we could also test that with drinking a glass of water, which would be more accurate in our testing. Okay, let me check and see if I need anything else. Oh yeah, this is the accessory cranial nerve that I need to check next, and that's checking the strength in your shoulders and your trapezius. So I'm going to ask you to lift your shoulders up. All right, and go down. And then can you lift your arms out? Okay, very good. All right, so that looks like your cranial nerve is intact as well. So everything's looking good so far. How are you feeling?
I'm fine, thank you.
Okay. I know this is taking some time, and I really appreciate your help with that.
That's fine.
All right, very good. So again, I would get my next for cranial nerve number 12. I'm going to take the tongue depressor again, and I'm going to ask you to stick out your tongue like this. And I would make sure, and you can push back. What I'm looking for is that your tongue is midline, and then I would take my tongue depressor and press your tongue one way or the other to test for tongue strength. And with that, we're just testing to see if you have dysphagia or anything like that. And it does not look like you have anything like that. You look as normal as you can be. But again, testing the midline of your tongue and testing the strength of your tongue. Okay? So that is cranial number 12, and that is the hypoglossal. So I want to make sure that I've gone over, I know we went over nerve 7, the facial, nerve 8, the acoustic, 9, the glossopharyngeal, 10 was the vagus, 11 was the accessory, and 12 was the hypoglossal. All right, so the next part is I'm going to ask you to stand up. So now we're going to do a little yoga. Okay. All right, and so I'm going to ask you, and videographer, if you can help me, I'm going to ask Miss Morris to walk that way. Just walk, generally.
Just
however.
walk this
And
way?
when you're walking, I'm looking at your gait and your posture. If you'll turn around. This time, Miss Morris, if you will walk on your tiptoes back to me. All right, very good. So you look like you're intact there. And this time, if you will walk from heel to toe back that way.
I have heel to toe.
Heel to toe, 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 and turn around. Looks good.
Not good with flip flops.
And have you already done tiptoes? Let's go on your tiptoes.
Back. Okay.
Yes. So I looked at heel to toe, tiptoes on your. Did you do heels? Just go on your heels.
Just heels?
Yep,
No.
just on your heels back that way.
That's not okay.
That's not as easy. Okay, and then I'm just going to ask you to do a deep knee bend if you can. Just as deep as you can. Very good. Okay, very good. That looks good. Can you hold your arms out like this? And then I'm just going to press down on them. Okay, and then can you close your eyes? And I'm just testing to see if you've got any sway or any dizziness. Do you have any dizziness at this time? Okay, and then you're going to feel a little pressure. and then you can open your eyes back. And what I was testing there to see if your arms went back into place, okay? So again, looks good in that sense. And then I'll ask you to take a seat right here. And then that is looking at your lumbar, your pronator drift, and then if you will, take your hands on your lap and then go back and forward and back and forward. And can you do that rapidly? Okay, very good. And that's just taking, again, a neuro assessment on your hands, okay, and your brain. If you will, take your finger, take one finger and touch mine, and then touch your nose, and then mine, and touch your nose. Very good. And that again is testing just some more neuro features. Okay, so let's see. We've done gait, we've done motor skills. Let me just make sure I don't have to do any other. Oh, I know what I need to do. I need to ask you if you can run your foot along your shin. Can you run your foot along? Yep.
Along my shin.
Yep. And can you do that on the other foot? Okay, very good. So that looks good as well. So let's see. The next part of our neuro exam is I have in my hand a couple of items that I'm going to ask you to close your eyes and hold out one hand, and if you can tell me what this is.
I can move my hand and stuff?
Mm-hmm.
Okay, so it's smooth.
Mm-hmm.
It's round.
Mm-hmm.
A coin.
Yep, that is a coin. Very good. All right, check. And then if you'll close your eyes again, and then you'll feel this. You can move it around.
A paper clip.
Okay, very good.
Okay.
Okay, very good. So I'm going to place that right over here on the table, and that is testing for stereogenesis and graphophysis. Graphesthesia. All right, so I need to take that cotton ball again, where did I put it? Well, I don't have it, so I'm going to use this. I don't know what I did with it. So we're going to take, I'm going to just see if you can feel dull and pin on your upper extremities down to your lower extremities, okay? So can you feel this?
Mm-hmm.
Is that sharp or dull? And when I say
more sharp.
So this would be sharp and this would be dull.
Mm-hmm.
And of course you would have your eyes closed in this.
Okay.
Okay, so what do you think of
Is
that?
that soft?
Mm-hmm. And then over here.
Is that kind of the sharp?
Yes.
Okay. That's soft.
Right.
Or
And then,
feels soft.
okay, and then I'm going to do that while I have my equipment out. I'm going to also do this down on your legs.
Sharp, sharp, soft, soft.
Yes, and then I would take that paper clip, and then if you did not have jeans on, in an exam, you would have your gown on in my exam room, and what I would do is, this is a 2-point discrimination, and what I would do is I would place this, and if you will tell me if you can feel 2 points or 1 point, okay?
Do you need me to do my pants up some?
No.
No.
It'll be right.
Okay.
It'll be right.
Am
So
I
just
closing
close
them?
your eyes and tell me if you can feel 2 points or 1.
Oh, sorry. Like 1,
Okay.
2.
Okay.
I don't know. 2 maybe. 2. 1.
Okay. And essentially what we're looking at, that's okay. It's
okay.
This is never a wrong or right for your assessment, okay? It's always the assessment of the patient. So it's never wrong or right. But essentially what you see is in the upper extremities, usually you can feel 2 points. Down in the lower extremities where we're further away, you can only, generally, even though I've pressed 2 points on you, you can only feel 1 point. So that's just another form of an assessment that we will look at for your neurology, okay? So let me just make sure I've got everything I need to have. So I also need to check if I have my, we're looking at deep tendon reflexes. So you have deep tendons, biceps, triceps, and your patellar, and then you have Achilles. So we'll check those bilaterally across, okay?
Okay.
So sometimes the tricep reflex is a little more difficult to feel. You may or not feel it, but I can see generally like a little bit of a twitch, okay? So it's a little bit, like I said, a little awkward at times. So I'm just gonna hold your arm up, if you'll just relax it. And then if you There you go. Did you feel that?
Mm-hmm.
Okay. And while I'm on this arm, and I would check bilaterally, but I would also do your brachial. Yep. And then you have a radial reflex as well. And then we would check on this arm. And then it's a little, like I said, it's a little awkward. And I did see a little reflex there. And your brachial. And we do have a radial. And then if you can sit back just a little, kind of see if we'll look at our knees. Right. Yep. And then I would check your Achilles. And all right, very good. So it looks like you're doing a good job with your deep tendon reflexes. So I'll just put that there and just make sure that I am going over everything. And while I'm doing all of that, I want to make sure that I do note to my videographer that I'm checking bilaterally. I'm checking the strength, and I do want to check your strength, by the way. If you can push up and down and out and in, very good, and up. Can you press your legs up?
Mm-hmm.
And then can you press your legs down and then out and back in? Very good. And then hold your hands out like this, and do not let me open your fingers. Can you open your, all right, and then hold your fingers out, and don't let me close your fingers. All right, very good. And then don't let me hold your hands in a fist, and then do not let me lift your wrists. Can you push up? And then can you push down? Okay, very good. So, and I want to check bilateral strength in that, okay? And I did check your legs as well. So I want to make sure I do that. Let me just make sure I have all of my equipment. And we checked your finger strength. We checked, oh, I do need to look at your, let's see, I did that, deep tendon reflexes. I do need to check for your hip, abductor, and adductor. I hate to ask you to stand up one more time.
That's fine.
All right, and then if you can, are you able to lift your leg this way, one leg out, and the other leg out? Very good. And you kick forward and kick forward, and I'm just, yep, good job. So your hips look like they're intact as well.
Okay.
All right, very good. All right, thank you, Miss Morris. If you can sit back.
Sit.
Yes,
Okay.
ma'am. So we checked all of that. I think we've come to the end of the neuro assessment. Let me just make sure before we get started, I'm going to check your chart to make sure that I've gone over everything to include in your neuro assessment. Okay. Let me just check your chart real quick. We did the Achilles. Oh, I know, I have not checked a couple of things. So I need to check, this can be a little bit uncomfortable. If I were to check your abdominal reflex, I would have you lay down. So if you'll lay back as far as you can into the chair, as you can. And because you have been very gracious in allowing me to do your assessment, I'm not going to ask that you expose yourself. But in order to do the abdominal reflex, I would check where your umbilicus is, go above your umbilicus, and then we would just gently place my hammer down to see if there's any type of reflex, okay? So I'll just show them on the assessment how I would do that. So I would check gently to see where your umbilicus is. I would go above and then run my reflex hammer down, and then you should see some abdominal reflexes. Then I also have to check a Babinski, and that is, you've probably heard that with babies, but on the bottom of your feet, we have a reflex as well. And the normal reflex is to have our toes come inward. So if you wouldn't mind me letting me check that, and then I would just come like this, and you did have a reflex there, positive reflex, and yep, and you have a positive reflex. Very good. Those are cute flip-flops too. Thank you. Very good. All right, so we checked that. I just want to make sure that I check your complete chart and your electronic medical record before I send that in. And so I'll just do that really quickly before we turn everything in for your assessment. So we've done that, and I believe hands, did we check your wrists? We did your hips, extension and flexion of your hips, we checked. Reflexes, drift, okay. And then also, when we're looking at one of the other assessments that I need to make sure that I talk about is passive range of motion. So I know that you did some range of motion, but the other thing that I need to make sure is as you were in the room with me, I'm looking at your muscle, if you're flaccid, making sure that if you are you have strong muscle tone, and I would look at your larger muscles, your biceps, your quads, your forearms, your all of your different muscle groups, to make sure that I look at your muscle elasticity and tone. So in this particular assessment, I see that you are normal in all of the above. Before we end the assessment, I wanted to ask you if you had any questions for me.
I don't think so.
All right, so this ends the assessment. I'm pretty sure that the medical assistant will come in next and do some vital signs. And then if you have any questions, we can definitely address those at that time, okay?
Okay.
So thank you, Ms. Morris, for your time, and I appreciate the videographer's time as well.